Pregnancy is a natural process, so if it's not happening or if it's not sticking, something is missing. After having a family member go through infertility and experiencing a miscarriage myself, I realized how little support and education women have around infertility. I want to change that. I'm Dr. Jane Levesque. I'm a naturopathic doctor and a natural fertility expert. Tune in every Tuesday at 9 a.m. for insightful case studies, expert interviews, and practical tips on how you can optimize fertility naturally. If you've been struggling with infertility, pregnancy loss, women's health issues, or you just want to be proactive and prepare yourself for the next big chapter in your life, this show is for you. Today, I had the pleasure of connecting with Dr. Nick. Dr. Nick is a chiropractic doctor that I actually worked with. My husband and I worked with him for a year and a half, and there's a reason that I chose him. He works with Dr. Randy at Total Body Wellness Clinic, but he is also an lead educator at Cellcore. So he helps to educate clinicians on how to use the products and the power of the products. And one of the things that he specializes in is chronic illness, but more specifically, parasites. I get so many questions around parasites. Do we need to treat them? Do we have them? How do you know you have them? The testing that you can do for it, what to expect when you start getting into parasite cleansing. And we're going to cover all of these questions in this episode. I hope you guys enjoy it. Hi, Dr. Nick. Thanks so much for being here today.
Hi, I'm excited to be here. Talk about one of my favorite topics.
Yes, parasites. That is the most exciting topic. I think, like I told you just off recording, that most people that come across me, they don't think that they have parasites. And then, of course, as they watch some of my content, or if once they start working with me and they realize that they do, they have a lot of questions. So I love to have the expert on parasites here with me today and detoxification in general. Let's dive into it. Tell me, do we really all have parasites? Where are they coming from? How are we getting them?
Yeah, and parasites, there's a lot of misconceptions, I would say, about parasites and kind of one of those taboo things that nobody wants to talk about. I've had people where they've brought it up to their medical doctors, and all of a sudden their medical doctors want to do psych evaluations because they start talking about parasites. So there's a lot of, I guess, unknowns or questions about parasites. So parasites, it's one of those things I feel like everybody has. And like bacteria, there's that healthy level, that homeostasis that we all have. I feel like parasites do have a unique role in us. It's again when they get overgrown, that's when they become a bigger problem, a big issue. So it's all about keeping things back into balance. A goal with parasite cleansing is not to kill absolutely everything in the body, otherwise we would cease to exist. But
That's a really good point because I didn't realize that about parasites. I do understand that about obviously because when we have pathogenic bacteria in our bodies and there is a normal level of, quote unquote bad bacteria that we should have, but they need to be at bay versus it's when they come out of control. So I didn't realize that about parasites. That's a really great insight.
yeah, and so part of that is in the unique role of parasites is it's almost like they are there to protect us from certain things, yet they're still parasites and they're wreaking havoc in the body and going all different places in the body. And so one of the interesting things as I was digging into the research on parasites and just trying to understand them more, I came across a fish study that was looking at comparing lead and cadmium levels. So in the lake versus the fish versus the parasite that was in the fish. And the interesting thing that they found is that the parasites actually had 2,400 times the amount of lead and cadmium in them than the fish and then the water. So this brings up the question, okay, why would they do that? And one of my thoughts is that in a way they're there to protect us from some of these chemicals and toxins that we get exposed to. So they are absorbers of toxins, and there's a lot of studies out there too that even get into that there's all kinds of other bacteria, other parasites, fungus inside the parasites. So it's almost they're almost like the Trojan horse as well because It looks like just the parasite, but there's all this stuff inside of them. Another quick, interesting study was a duck study, and they were looking at ducks that they treated with antiparasitics versus ducks that they hadn't. And what they found is that the ducks that they treated with the antiparasitics started having symptoms of lead toxicity, which again starts to bring up a bunch of different questions. So, again, with the group that hadn't been treated for antiparasitics, they didn't have any of the associated symptoms. So some of those were smaller clutch sizes, so less reproduction or changes with reproduction within the ducks. And the so the other big piece that I take out of that study is the importance of one, bringing down the overall overgrowth of parasites and the impactfulness of that, but the importance of also making sure that we're doing things to clean up our terrain, our environment, so that we're not dealing with the repercussions of these exposures that we have to these different toxins. So it's almost like a 1-2 thing. One, when we're having all these different health issues, bringing down the overgrowth, bringing things back into balance, but also it's cleaning up the environment, cleaning up the toxins that, again, at some point they're seeming to protect us from.
Yeah, so is it fair to say that the because it seems like there's this parasite epidemic, right? Like, we've been talking about it for a really long time, but now like the mainstream medicine is catching up. But is it fair to say that the toxins are the reason that the parasites are overgrowing in the way that they are? Is that kind of what we're seeing?
Yeah, and that's I feel like a big driver of why there's the overgrowth of parasites. It's comes back to the fact that we're being exposed to more toxins than we ever have been through our food, through in the environment, in our water. There's the EPA list of known chemicals out there. There's over like 84,000, like 45, 46,000 that are currently being used. So there's a lot of stuff that we do get exposed to, and that accumulates in us. And again, leads to, I believe, that overgrowth of parasites. I mean, you can throw bacteria, fungus in there as well. They're a big piece of that as well. But definitely, I feel like that's a big driver for a lot of the parasite issues that we have. So there's that one side of it. There's obviously we can still be exposed to different things, which that can play a role in it. But at the same time, we have to our bodies almost have to be that susceptible host for that overgrowth to occur, which again, I feel like a lot of times goes back to the toxicity and how that jacks our biochemistry and creates that environment that's very favorable for the parasites to be there and live and grow and thrive.
Yeah, I don't know if you know like a stat or if there is anything like that, but like how much do you feel like it's coming from within versus we're contracting it? So we like think that, okay, I went to Mexico and I got a parasite, or I drank, I went overseas or I did something and then that's how I got the parasite. Where right now, obviously, just this short discussion, it's like, hey, maybe that's not the case. Maybe parasites have been there, but then that toxic load has just created this perfect environment for them to thrive. Do you know if there's a percentage of like 50% is contraction, 50 is from within, or
That is a great question. I guess I haven't come across any stats on that.
I think it would be really hard to track.
It would be.
Yeah.
So you brought up a good point. I mean, again, part of the one of the myths out there, which there's some truth to it, this myth of that we need to travel to Mexico or some foreign country to get exposed to parasites. That we have this perception that the U.S. is this clean, and in Canada, even like there's this clean environment that there's no parasites magically here, but that's not the case. Parasites are everywhere.
They are in the fish and potentially like if you're eating fish, right? That's exposure.
Yep.
Raw fish, sushi.
Raw fish sushi, so that's one thing you'll never catch me eating is raw sushi. I do like sushi, but it's always the cooked cooked version of it. Not properly washing produce can be a big exposure. Drinking contaminated water, swimming in contaminated water, being exposed to
How do you know the water is the contaminated? Like, because lakes essentially is just you could just say that that's contaminated water.
pretty much. But
Yeah.
again, that's where we'll probably get more into this later, but the benefits of being proactive, keeping the body healthy, and doing regular parasite cleansing to make sure that we're staying on top of any exposures that we may have or come across. So going to foreign countries, like you said, there's probably some truth to that, where I think we're definitely exposed to different parasites than we're exposed to in our environment. So there's some truth to that.
It's like your immune system isn't used to that particular parasite, and that's what right? Versus just because when people come from foreign countries into our country, they may experience the same thing, and that's just yeah.
So that's always one thing if somebody's traveling different areas. Again, I always like to be proactive and have them start taking some anti-parasitic formulas before they go, while they're there, and even for a while when they come back. And again, just to be on the safe side so that we're not dealing with some big infection and dealing with not feeling good when you're on vacation, because you want to feel good when you're on vacation. So it's just being proactive.
Yeah. Now, for those of people who like data, I know Dr. Todd's famous test is if you have a pulse, you, you have parasites. Do you bother doing any testing? What kind of testing do you do? I've talked about even like filling out certain forms that help us like correlate certain symptoms to parasites. What have you done that's been actually really helpful for people to recognize that they have parasites and, to connect the dots even during the treatment?
Yeah, so I've found some challenges with certain or with a lot of tests where they may not show parasites actually coming up on the testing. So I think there's definitely some limitations to doing like a stool test and seeing things that show up. If you are seeing things that show up, obviously I feel like that's a big sign you probably have a big overgrowth. But there's definitely some challenges with the like stool test, for example, just because you're only looking at a certain percentage of the parasites. So with parasites, the big thing that we always think about is the big ones that you hear about and see, but a lot of the parasites we actually don't even see. They're more microscopic. So only about a third of parasites we can actually visibly see. About two-thirds, roughly, we can't even see. So just the fact there that puts some challenges on the testing, because those microscopic ones, they're not going to be in the stool. It's one of those things with parasites, not fun to think about, but they essentially can be anywhere in the body. Again, we have this almost perception that they're always just hanging out in our digestive tract, but again, that's not always the case.
There's lots of more stuff coming out, like, they found parasite in the brain and in the blood or in the heart, and you're like, "Yeah."
Yep. Yeah, I think there was a article, I don't know if you saw this one, Jane, on RFK talking about a parasite that he had found in his brain many years back. And so the one interesting sidebar too that kind of goes along with talking about parasites in the brain. So one of the things I work a lot with is people dealing with Lyme disease. And one of the studies, Dr. Alan McDonald, with some of the research he was working with people that had passed away from MS, and I think there was 12 cadavers that he was looking at, and 12 out of 12 he found nematode parasites. So nematodes are just a type of parasite, and within the nematodes, he found strains of Lyme disease within there. So you can find parasites in the brain. Again, it's not one of those fun things to think about, but it's
This is when the conventional system sends you for a psychiatric evaluation.
yep.
But, I've had people with Lyme disease on, and they were just like, the amount of brain inflammation that you experience and you feel like you're crazy, and it's just like, "I'm not crazy, I have brain inflammation." I think it was Heather Gray that said that, and it's like, "Yeah, you're not crazy, you just have brain inflammation." But, when your conventional doctor doesn't believe you, it's very easy to just be like, "No, no, it's just me." It's like, "Nope, you're not. It's actually just like a parasite in your brain that's making you go nuts."
Yep. Yeah. So For where we were going there. We were talking about lab work.
Lab work, yes. Finding parasites, it's tricky to test them.
There we go. So with testing them can be tricky. So one of the things that so I don't know if you're familiar with Dr. Klinghardt. One of the things learning from some of his teachings um, years back, he talked about how parasites release different enzymes that essentially, once they're out of a host, they start breaking themselves down. So by the time we're looking at like a stool test, for example, by the time that stool test would get to the lab, get tested, parasites were basically showing up undetected because they broke themselves down. And the other challenge is their labs are only looking at a certain percentage of the parasites. So what you have and what they're testing for may not be one that they're looking at. And I've seen this to be the case. I mean, I've had clients where they've clearly passed parasites, took it out of their stool, sent it to the lab, come up negative as a parasite. So see, there's
I've had patients do the same thing. They're like, "Nope, can't be the parasite. They must have eaten something weird." Like, I mean,
yeah. So I've seen that where certain testing, again, doesn't show anything, but then as soon as you start doing parasite cleansing, it's like all this stuff starts coming out. It's like, why didn't that show up on the lab? So labs again, there's definitely some limitations there. Questionnaire, you mentioned questionnaire. That's one of the things that I have everybody fill out is a big questionnaire. Part of that is asking a bunch of parasite related symptom questions. So you can find out a lot just based off of symptoms. So a couple big ones. One is anemia or low ferritin, low iron levels. Because a couple examples of where parasites can and how they can affect are things like anemia is certain parasites like babesia, malaria, they actually live inside the red blood cells. So they're basically hijacking red blood cells, damaging them, which is going to play or affect how the oxygen levels are. So energy levels, but also affect iron levels. So again,
yeah, it's something that I struggled for a long time. Like, I had low ferritin and low iron, and it was always like, "Oh, it's because I'm pregnant and then postpartum and I'm still recovering." And before that, it was IBS, which really was parasites. I obviously just didn't know that. And with myself and with most of my patients, they're like, "I can't believe my ferritin and my iron levels. They've never been like that, and I'm not taking any iron, and they're not doing any even organ meat blends or whatever." So it's like, as long as you're eating certain foods and there isn't a leech that's eating up all your iron stores and your red blood cells. I don't remember who said that at Eco. It's like red blood cells are like a ribeye to parasites. It's just like, oh, cool. Makes sense.
good analogy.
Yeah, good analogy. Very good. People understand that. I love ribeyes.
And then you have like hookworms where again talk given the leech analogy, I mean that's essentially what they do is they hook on, they literally have like a hook and they hook on and again just take our eat our blood basically eating that ribeye. So you can look at different values like lab values for anemia, iron levels, eosinophils, that can be a big one, a big red flag for parasites. So elevated eosinophils, elevated CRP. So CRP is a protein made by the liver and an inflammatory marker. So parasites create a lot of inflammation inside the body, wreak a lot of havoc. One from some of the tissue damage that they can cause, but also they're pooping, they're peeing, they're releasing different toxins that will trigger that inflammatory process within inside of us. Another big area that parasites love and definitely affect is the liver. So you can look at things like liver enzymes, ALT, AST, alkaline phosphatase, GGT. So there's a bunch of different lab values on more your standard blood work, CBC, that you can look at to get some good indicators as far as okay, you start checking a bunch of boxes off. Okay, seeing this, definitely looking at symptoms, seeing big changes around the full moon,
Rashes. Talk about
rashes.
rashes.
Yep, yep. So again, start seeing all these different red flags. Okay, know that parasites are going to be a piece of this puzzle in your journey and getting you well. So, so yeah, there's definitely some challenges with it, but there's also a lot of good markers out there and good ways to evaluate.
Yeah. I mean, if I see any inflammation in the gut, so like I'll do stool analysis, and for the most part, I'm not doing stool analysis to look if there's parasites. It's I based on what I've learned through Cellcore and just like, my own journey and with my patients is, hey, we do have a high parasitic load because we have a high toxic burden load. And we just need to see how bad it is and how much the inflammation, because like you said, if you are actually seeing parasites in the stool, usually that overgrowth is really, really big. And when I've detoxed parasites and environmental toxins, all of a sudden progesterone levels go up. And there's no amount of Vitex that this, woman sitting in front of me she was taking it for years. And she's like, I heard it takes time. And it's like, it doesn't take years to get, you're working on the wrong thing. And that's just because there's something else that is causing the deficiency. So I very much am in like, yeah, if you have a pulse in our day and age, you probably have parasites, but the level of those parasites is going to be very different for people. And usually the discomfort is there in their symptoms.
Yeah, and I think there's that misconception too is that when you do parasite cleansing, everybody's going to see all this gobs of stuff coming out.
'Cause there's a lot of people online sharing it now, and so it's like that's the 1/3 of the people who can see it. But, a lot of people don't have it visible.
Yeah, and
Or you're, like, not digging through your stool because you just, like, whatever, like,
it's not very noticeable.
yeah, just let it go.
Yeah, yeah, it's interesting how working with a bunch of people, how they become detectives with their stool and getting out their plastic forks.
Their chopsticks. I think Javen had a really great post where he's just, like, puts the chopsticks, and I was like, "Yeah, these people are nuts."
Yeah, so that's the big thing too is like not everybody's going to see stuff come out. I can't say that I've definitely seen stuff, but it's not like I've seen like this huge amount of stuff coming out, but I've definitely had clients where they've seen lots of stuff come out. So there's a huge range and variation as far as what somebody sees as their parasite cleansing.
And let's talk about the full moon. Why is the full moon, a reason where people get aggravated, parasites are more active? What's the actual mechanism here?
Yeah, that was the full moon. I remember back when Dr. J and I were in the office together. The joke was always when people were starting to act kind of crazy, is like, oh, must be coming up to a full moon. And again, not really knowing there was that big correlation with parasites and other bugs too being more active around there. So a lot of the life cycles match up with the full moon where and a lot of times even the new moon. So you got your full moon, and then 2 weeks later you got the new moon, 2 weeks later you got the full moon. So it's on a 2 week cycle. And so seeing that cyclical nature of symptoms where again it's either increasing your during the full moon or new moon, and there's definitely seems to be some variation certain full moons, whether they're more intense than others, if that plays a factor. But not every full moon I see symptoms increasing, but there's definitely a big correlation with that where I'd be all of a sudden getting a bunch of emails from clients around the full moons that wondering why their symptoms were increasing. Look at the calendar, and it's like, oh, coming up to a full moon. So starting to see those connections, digging into some of the research, there's fluctuations with serotonin and melatonin levels. There's some connection with the increase in serotonin levels that activates parasite activity. So there is even some connection there.
And like the melatonin decreasing, that causes the serotonin to increase, and that's what causing the parasites to get more activated.
Decreases the immune system, allows for inflammation to increase. So there's some other factors in there, but yeah, that's always one of the things that I ask every client as I'm doing their intake questionnaires asking them if they're noticing symptom changes around the full moon. And a lot of times I haven't really paid attention to that. It's like, well, that's something you want to start to track and see if there is that connection there. And
My patients say that all the time, and then I'm like, "How often does it happen?" "Oh, it's about once a month." "Okay." And so it's like once a month, and then I just start to like, "Hey, just pay attention," because sometimes it is more new moon, sometimes it's full moon, sometimes it's both, so then it's hard to obviously, and then if it's a female and there's hormone fluctuations as well, you're like trying to piece all of it together. But I just took on a male patient who, I mean, they're a couple, but he is struggling with all the rashes, all the signs. And it's like, how often does it come on? He's like, oh, there's no pattern, but about once a month. I was like, "Meh, I think there's a pattern." Yeah, let's figure it out.
yeah, and the interesting thing too is I think there's some misconceptions too. It's like it's got to be like directly on the full moon for it to be affected by the full moon. But one of the things that I've noticed is that a majority of people, it's almost that lead up to the full moon. So maybe 3, 4 days out, start having some increase in symptoms, and then again may last 3, 4 days and then starts to go away. I have had a few that don't really notice it on the lead up to the full moon. It's more after the full moon, but I'd say it's mostly that lead up to the actual full moon. So it's always one thing, or the thing I tell people is just kind of keep an eye around that week around the full moon. And then, so with knowing that parasites are more active around the full moon, can obviously use that as part of the treatment tool, in that you can do like full moon cleanses. So using their increase in activity to go after them. So that is a tool that utilize with clients, and it's more of one of those things I like to do that after they've done some more general parasite cleansing. Sometimes if somebody's brand new.
Improve their drainage, like liver is working well, gut is working well, you're hydrating properly, you've decreased at least some of your toxic load. Because, yeah, I've had people have reactions just by starting to eat more vegetables. So, like, when I put them on the 10 weeks detox and it's like you have to eat 2.5 cups, and they'll start at like 1.5 cups, and they'll start to have perks reactions, so like detox reactions, just from eating more vegetables. And it's like, not really ready to do a full parasite cleanse yet. Like, it's powerful stuff, you know?
Yep. Yeah, and that's where it's almost like you need to bring down some of that overall load, toxic load, and even parasite load. So early on, the approach, if there's somebody who's super sensitive, I'm not going to push it during the full moon. If anything, I'll maybe pull back on the parasite formulas, increase drainage, increase binders. And then as they're a more seasoned or advanced client, then we can push it more during the full moon and 3, 5 days around the full moons to just really go after things. And again, just going after the fact that they're going to be more active around that time.
Yeah. So, I mean, now that we're in this, how long should somebody be really like, what's realistic to cleanse parasites? I know that there's a lot of different factors, but I've had people come to me and be like, I've done parasite cleansing and it was like a 2 week or a full moon cleanse, or maybe even a month, where they felt like they really gave it their all. What's actually realistic for people when it comes to parasite cleansing?
Yeah, to do a deep, thorough parasite cleanse, I generally tell clients minimum 6, 7 months, but realistically, it's going to take longer. And there's always that, how the heck does it take that long to clear parasites? So, a couple of things to keep in mind is that with parasites, they can be at any level of life cycle stage, from an egg to a cyst to immature adult to an adult. And so the different herbs are going to obviously target different stages of life. Some may be good at going after eggs, some may be more at the adult forms. So the fact that they're in different stages of life, it can take some time to basically get ahead on clearing them out faster than they can reproduce. And example of that, as I was again researching parasites, that always has stuck with me is looking at a single female Ascaris lumbricoides, a roundworm. One adult female can lay over 200,000 eggs in a day. So trying to overcome,
Damn.
yeah, trying to overcome that, let alone obviously if there's more than one. So it can take some time to, again, it obviously takes time to get to where it's a problem. It can take time to go the other way and create momentum that you're clearing more than you're they're accumulating. So persistence and consistency of parasite cleansing I found to be the most impactful things when it comes to clearing parasites. And again, it can take lot longer than you would think to clear them. I mean, I've had circumstances where I've clients who have been clearing parasites for year, 2 years,
And
and
like clearing you actually, they're like pooping them out and
physically seeing them. Yep.
yeah.
So there's a lot of factors that play a role in why somebody would be seeing them for that long and still clearing them.
What are some factors? Is it like they're still exposed quite a bit? Like there's still a high toxic load?
Yeah, those are probably gonna be the 2 big things. High toxin load, so maybe they're still living in mold, maybe there's still something in their toxins in their water, the foods that they're eating, and then it's maybe something they've got their lovely animals that they're continuing to, expose them to. So, again, there can be a lot of different factors, but some people, again, it's just takes longer. Their immune system's more suppressed. There's just, again, a lot of things that they have to overcome to get ahead essentially. And so everybody's a little bit different in how long. And as I mentioned too, it's like some people see gobs of stuff coming out, some people don't. The other interesting thing, kind of going back to the where toxicity plays a role into things, I've seen a correlation where there's certain clients where it's almost like there's a bigger toxicity issue that helps to unlock the parasite issue. And then there's the people that it's like they look at the bottle of parasite formula and it's like they start passing parasites. So, with that second group, you definitely need to do some deeper parasite work and be working on bringing down the overall toxicity level of things. And then that other group where toxins seem to be a big factor, they tend to be people where they can jump up to relatively high doses relatively quickly, very minimal symptoms, if any. But you start doing some deeper detox with them and then circle back and do some more parasite cleansing. It's like all of a sudden floodgates have opened up and start clearing parasites at a whole nother level. So
Yeah, that was the case for us too. Like when we worked together and there was a lot of, when we did lots of drainage and it was like that drainage activator being at 6 caps twice a day for, I don't know, 2 months, I think it was, or even 3 months, really high dose. And then all this, and then do a parasite push. It's like, wow, there's a lot more stuff that all of a sudden has come out that it felt like your body just wasn't ready or didn't have the drainage capacity, right, to get rid of it. It's huge.
yep. And I was kind of same category too, where I definitely needed to do more detoxing, and it's very similar with higher dosing drainage activator. And then I was able to start clearing some more stuff. So yeah, full moons again can just be a tool in the toolbox as far as how to go after parasites.
Yeah. Tell me, is there an instance where you go for meds versus just relying on the herbs? And how do you know when it's the time to do some meds?
Yeah, I would say majority of people don't need to go to the herbs or the
Meds.
meds. I find that the herbs do really well at clearing things, but there's definitely those tougher cases where you're doing all their due diligence and high dosing some of the parasite formulas and just again can't seem to fully get over the hump. Then that's where utilizing some of the parasitic or medications can come in handy to help with, again, just going to that next little level. But the one of the drawbacks that I've seen where why wouldn't you just go to the medications versus the herbs? is that a lot of the medications aren't going to go after and address the eggs.
The drainage or the drainage capacity, right? Like liver function, gut function, all that stuff.
Yep. Yeah. Yeah. I mean, being a medication definitely can be more challenging on liver, kidneys, just some of those different drainage organs.
Yeah, I've had to there's a couple patients that I had to because I don't wanna say, like, I would take it back because you wanna try the herbs first. You wanna I mean, the first thing I do before you introduce, right, is that drainage. You improving drainage and energy so the mitochondrial function so your body actually has the energy to detox. And then, I had a kid and I know that the mom is gonna listen to this podcast where it's like, "Hey, we've done for, like, 3 or 4 months, and he's still not he's, like, passing a little bit of eggs, but not like, he still has this umbilical cord pain, like, behind his belly button, this severe pain." And then when we do the meds, usually it's like a day, right? Depending on the medication that you choose, you're only taking it for a day, maybe 2 or 3 days. And then once we did that, he really started to pass a lot of parasites because it just kind of opened the floodgates. But then the herbs come in to help support killing the eggs, supporting the drainage. And a lot of the herbs are like anti-inflammatory as well. So I find that they really help with like immune system regulation. And so the meds, as appealing as it might seem to just be like, just do this thing, it's 3 days and you're done. A lot of the times it might get like the big mother, but it doesn't get all the eggs and everything else that comes with it. So you have to do the inflammation support. So I wanted to, thanks for your insight there. It's what do we do, because it's you want to get them out, but sometimes you do need to pull out the quote unquote big guns.
Yeah. Yeah. And that's even where I found the impactfulness of doing even some of the high dose parasite pulsing. So, high dose, shorter time period that you're doing that.
Yeah. How high dose do you go just so people understand? Because I think they're like, I took 4 caps twice a day.
Yeah, so me personally, and I don't have all my clients go this quite this high. So like with Para 4, I've went up to 20 caps twice a day. Para 3, I've did 10 dropperfuls 3 times a day. So can go pretty high, but again, taking that amount of herbs can be challenging on the body and let alone if you're clearing stuff. So again, that's where you want
You
to.
have to know what you're doing at that dose. Like you just have to, you have to have the drainage tools. Like when I have in my program, like here are the drainage support things. And it's like how to sauna, red light therapy, castor oil packs, coffee enemas, water enemas, like dry brushing, all of these things where it's like, if you're gonna push your system, you better know how to support it instead of just like sign up for a marathon and hope that they have what they need, what you need at the aid station. It's like, no, 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 we're not gonna do that. We're gonna set up our aid stations.
Yep. So again, that's definitely a more advanced move. It's not something gonna do with somebody brand new. It's again after you've cleared out that low level things. And again, sometimes you need the big guns, higher dosage to go after the big ones. So more herbs that you have, the more it's gonna go after those bigger ones and basically kill them and clear them versus at lower doses, maybe just poking the bear and ticking them off. And that is the interesting thing that I've seen with some people is that it's almost like they get more symptoms at lower doses than at higher doses. Because again, you're poking that proverbial bear, ticking them off with just a little bit of the herb. So they're mounting a response, releasing different inflammatory markers, cytokines, and creating that uncomfortableness, creating those symptoms so that we basically want to stop killing them. But it's again because they want to live, they don't want to die. So it's yeah, so it's understanding some of those things as you're parasite cleansing. I jokingly tell people kind of expect in everything when it comes to fluctuations with symptoms and seeing things coming up. And talked about skin rashes, changes with bowel movements, changes with sleep. You can experience a lot of different things. And again, it's because of how they're affecting our body and again, trying to make us feel uncomfortable. So it's that delicate balance of going after them because if you're getting those symptom changes, it's a good sign that you're going after the right thing. It's one thing from a symptom standpoint. We've always kind of been trained that symptoms are a bad thing, but at the same time can be a good thing in that it can be part of that guide that we are going after something. And so it's again kind of keeping things in perspective that if we are seeing some of those die off symptoms as we're going after parasites or whatever we may be going after, it's a good sign that we're going after a bigger factor in why we're having health issues in the first place. So it's definitely something we need to lean into and go after. But again, it's going about it in a smart way where we're pushing, but not pushing too much too quickly. We're triggering a crash with somebody. That's the last thing that we want to do. So it's adjusting the dosage as we need to. Maybe we need to bring in some extra drainage support, some extra binders just to help with symptom management.
The die-off effect, yeah.
Yep, as we're clearing things.
Yeah, I would say it's different when you're have symptoms and that's just your state versus you are working through something in the body because the expression of of the bug is how the body heals. Just like we have to express the emotion to release it. It's the same, it's the same thing here. And I remember when we first started doing parasite cleansing, I would just get this like crazy rash on my stomach, on my lower abdomen, kind of where that sigmoid colon is. And it would just be like really big and really itchy and it would be around ovulation. And so the reason that it's around ovulation, which kind of has really clicked for me, is because pathogens really love estrogen. And so it's a really great time to test the female for gut, vaginal microbiome, any like pathogenic STIs, STD screens to do it around ovulation. So every time around ovulation, I remember it was like a really big rash. And then the next month it was a little bit smaller. And then the next month it was a bit smaller. And then it was, just kind of like you could see that the skin wanted to flare out, but it didn't. And then it was just completely gone. But it took like 4 or 5 months around ovulation to see it go from, really big progression. And, sometimes when you feel like these things don't make sense and it's like they always do, you're missing something, right? Like you're missing an piece of information that you know about a certain pathogen or how it is or the life cycle. And, you being a researcher, I'm sure you can resonate with that where it's like, oh, got to go deeper into the rabbit hole and find that piece of information that I'm missing.
Yeah, bringing up even fluctuations with cycles and parasite cleansing. That is one interesting thing I've noticed with a few clients where there's always certain formulas would trigger it more than others, but they would start taking the formula and be like 3, 5 days in to taking the formula, and all of a sudden it was triggering a cycle with them. Start having their menstrual cycle. It's like, hmm, okay, we're definitely getting into something here.
Yeah. That happened to me a couple times as well when we were working together.
Yeah. So you can notice even some fluctuations with cycles as you're parasite cleansing. One, I think the how the different parasites can affect our hormone levels and trigger some fluctuation there, but also I feel like part of it can be the body being smart and with the cycle, the I feel like the body's just going through a big detox, a big flush. It's just trying to get rid of excess things. So you're clearing a lot of things. So it's just trying to facilitate that. And the other thing is that can have parasites in the uterus. And so again,
And you do, yeah, I was just say, ladies, you can pass parasites through uterus. Sometimes my women are like, I found something in my cycle, but it's not mucus, it's not a clot. And I'm like, sorry, we got to get it out. Like, it makes sense why you've had implantation issues or you've had a lot of pain in your cycle or whatever. Because if there's little critters that have made it home and they're, causing issues and inflammation within your endometrium, it's like, we got to get them out.
yep. Yeah. So with some of those, yeah, one of them was looking at toxoplasma gondii, so toxoplasmosis. So that's a parasite that's common in cats and cat feces. So one of the, I guess, the things to avoid for pregnant women is to not change the litter box for during that or while they're pregnant, because there can be that exposure to toxoplasmosis. And interesting thing with the toxoplasmosis is they found that it affects the testosterone levels. There's different studies where some of them it caused an increase in testosterone levels, and others it caused a decrease in testosterone levels. Interesting thing with this parasite is there's one or with increase in testosterone that obviously can play a pivotal role in certain traits, more aggressive behavior, more risk taking. There's a bunch of studies that were linked in this one study, how there was articles showing how toxoplasmosis and again the effects of testosterone levels and aggressive behavior, violent behavior, and depression, anxiety, and triggering all these different fluctuations. But it's one of those things we that I hadn't really thought about until coming across some of these research articles on how parasites can have basically an impact on testosterone levels, estrogen levels, and therefore can be even an impactful piece of the puzzle as to why some people are having trouble conceiving. And so the other study that was super interesting was another parasite that they found. This was a mouse study, and what they found with the male mice is that it increased serum estradiol level 200 times the normal value, and then testosterone they found decreased 90% of the control. And then with females, they also found an increase in estrogen in the blood about 8 weeks after the mice were infected, and then also triggered an increase in uterus size, and then comparing that to control. So affecting estrogen levels and testosterone levels in this study. And then another study was that they found a decrease in estradiol level, testosterone, and progesterone in females. This was a hamster study, I believe. And then what they found in the male hamsters was an increase in testosterone, decrease in progesterone. So again, the thing that I wanted to again just kind of reiterate with looking at these couple studies is how parasites have the ability to affect our hormone levels, which again can play a big impact in fertility and being able to conceive or troubles conceiving. So again, just very interesting studies.
Yeah. I always feel bad for all the mice and hamsters, you know?
Yeah.
These poor little guys just getting infected and then they're watching them.
Yeah. And then, yeah.
Well, the rabbit hole, like what I think would this is where you really need a practitioner because and I'm doing some training with Leah Hedgman, who has like a PhD on the OO side. And, she's working on another PhD, just a really phenomenal fertility specialist. But one thing she said is like, I'm not against anything or I'm not for anything. I just look at the patient because every patient is going to need something different. So for somebody, this is going to be an answer for you. And parasites is absolutely the main reason as to why you're not getting pregnant. For others, it's going to be something else. Parasites might be part of the picture, but that might not be the whole picture. I've had, some practitioners reach out to me after the eco event. It's like they've gone so deep into the parasite cleansing. It's like you're done with the parasite cleansing. Like you got to move on to the next step. So my question to you was actually, do you see, is there a benefit to, so you do the main cleanse, let's say that's 6 months to a year. Is there something that you recommend doing on a regular basis?
Yeah. So looking at parasite cleansing after you've done kind of your big parasite cleanse, doing some more maintenance parasite cleansing. So once, twice a year, I like to take about a month and do kind of a deep dive into the parasite formulas. And again, it's more just to be on the proactive side, just to make sure that we're not having that overgrowth of parasites again. Because again, as clean of food we eat, trying to control the environment as much as we can, we're still going to be exposed to things. We're not going to live in a magic bubble.
All the environmental lectures are, like, so depressing, and honestly, like and even, like, listening to Leah's 'cause, well, to me, she's like, "I know you guys are not gonna like me after this," and I'm like, I'm used to it because of just it's like, yeah, and the people that deny the environmental toxin, it's like, listen, I don't want to be the person that tells you your water is poisonous. Like, I don't want to do it. But, the 5 stages of grief, at least the old version, it's like the quicker you go through that and you stop bargaining or you denying, and, we go through the anger phase and then you have the acceptance so you can start do something about it, and then obviously impact your decisions on like consumerism and what you buy and the companies you support and blah, blah, blah. It's like, I don't want to be the person to tell you that we're living in a poisonous bubble, but we are. And you need to become aware and make the necessary steps and changes and, continue to thrive as much as we can in this world. But yeah, that's what I was going to say. It's like, hey, we need to do these cleanses, it sounds like, because of just this exposure that we have that's out of our control. A lot of it anyway, some of it anyways, not a lot, but some of it for sure.
It's definitely from working with patients for as long as I have. It's definitely been one of the most impactful things. I mean, just there's definitely been some bigger pieces as we've learned more, and just always researching, always testing new things out. Clearing parasites has definitely been one of those big game changers with working with people. Part of the background is working with a lot of Lyme clients, and with the Lyme people, where again there's always that cyclical nature of then have the Lyme symptoms come on, take some herbs, bring those down, go away, and 6 months later is coming back again. It's like, what the heck? Why can't we get ahead here and have things go away? It was when finally started to do parasite cleansing that really seemed to make an impact with that. And part of that is goes back to how even approaching going after things, and again trying to look at things from that linear system or approach of how to approach things. I do find that addressing parasites earlier on in the process is being one of the more impactful things. Again, part of that is going back to what we talked about earlier, in that you can have other parasites, other bacteria, other fungus, toxins inside the parasite. So if we're not going after parasites, you're missing a big hiding place for a lot of these things. So, in my mind, in order to really go after Lyme, go after and detox the body, parasites have to be a
Or even mold and fungus, right? Like if somebody is constantly, I see it all the time where people are like, I've been treating candida for the last year. And it's like, you're treating the wrong thing. Like it's not, it's still, symptoms are still popping up. And it is confusing for even as a clinician. I get overwhelmed all the time where it's like, oh my God, like why is this so complicated? But you also have to take it back down to the basics of like, hey, if you're not pooping, if you're not drinking enough water, if you're constantly bombarding yourself with toxins, like the body just can't get rid of stuff. Once you start getting rid of stuff, you have to test, you have to, see people on a regular basis versus just when they're flaring. It's, to actually make it be a successful journey to the other side.
yes, yeah, I definitely agree with that.
Yeah. A little bit of like I don't know, like a spiritual, I guess, question, but I'm wondering if you notice a change in personality and change in like, because you can look at someone and you could say, oh, this person has parasites. What is it that makes you say that? And the reason that I was thinking about this is, again, I was watching a module on the oocytes, and she's like, what did your eggs do for you? How would you feel if your eggs weren't functioning properly, or were in, how you feel in menopause versus how you feel at the prime of your fertility? And I was just like, yeah, there's something about even individual bugs, right? Like when somebody has parasites. Have you noticed something in terms of the personality and spirituality and just like how the person is when they have parasites versus when they don't? What is the change that you see?
Yeah, so I think even from energetic level, where we've had like those more energetic parasites in our lives, it's almost like it creates that energetic susceptibility to physical parasites within inside.
And when you mean energetic parasites, you mean people who leech things from you? Yes, okay. Just making sure we're on the same page. Okay.
Yeah. So again, there's definitely some connection there. I've seen even with like people with a lot of more like mental emotional struggles. I've seen this a big change with people where dealing with chronic anxiety, depression, anger, again, the sadness, a lot of those big emotions. I've also seen big fluctuations or changes with parasite cleansing. So there's a interesting book. This is Your Brain on Parasites. And that book helped to shed some light on some of this, on how parasites, through again the chemicals and toxins, neurotoxins that they release, and again, this even I feel like goes back to some of the toxoplasmosis study, and how it can, different bugs can cause some of these mood emotional changes, or again diagnosis of like bipolar, schizophrenia. I feel like even this goes into that conversation too, on how they impact the brain. And I've definitely seen that where you start parasite cleansing and all of a sudden big anxiety, depression, big mood changes with the parasite cleansing. And again, it's not that person is necessarily having those fluctuations. It goes back to what the bugs and some of the control and effect that they have on us and their brain, our brain. And so within that book, they give a bunch of different examples on how parasites and different animals and insects, and how they basically affect the behavior of the bugs. So basically, and even talked about it in that toxoplasmosis study too, on basically controlling the brain. So do different things to continue the transmission, or pass parasites to infect other people. So one of the things with the that toxoplasmosis study, talking about how high testosterone levels and how it affects females, it increases their, and males too, the desire to reproduce, and therefore during reproducing you're passing the bugs to other people. So it's a
Yeah,
transmission.
sharing and caring when it comes to the microbiome, like, unfortunately, but you're even like, you don't even have to be intimate, but like if you're sleeping in the same bed, you're sharing a microbiome, in the foods that you cook and how the food tastes. I think it's an amazing concept and it's really important to like if we are all bugs just walking around, and if you have these big parasites that are leeching your energy, I think the energetics of who you are will be different. And that's something that, like I couldn't pick up on until I got rid of more parasites. And then it's like now you could see it when somebody has a parasite, the way that they think, the way that they talk to you, even the way that they look. And then obviously the circle of people that they spend time with. Cause, I don't, correct me if I'm wrong, but sometimes we see people who are just getting reinfected. And it's because they haven't actually changed who they are and they continue to let people take advantage of them. They can't say no. They haven't set any boundaries. Their immune system is suppressed. And so they're just going to continue to get reinfected every time they go out to eat at a restaurant. Boom, their systems flares because they just haven't, they haven't set up the boundaries or they haven't actually changed who they are.
Yeah, and one interesting observation that I've seen too is, as people where they've definitely the emotional side, mental emotional side is a bigger piece for them, and start to use different programs or seek out help to work through those things. as they start releasing, again, kind of that, talking about the energetic parasite, releasing some of those stuck emotions, it almost leads to that physical release of parasites. And even with like the new me support, I've seen a very similar thing where having I've had people where they're not on any parasite formulas, but yeah, I got mine right here too.
There you go.
But start taking something like me support, where it's again going to help with clearing some of those stuck emotions, and all of a sudden start passing parasites. And it's not a anti-parasitic formula. It's just, again, there's something with that emotional.
Your nervous system has relaxed too, right? Like your nervous system has relaxed and it can release. And yeah,
So yeah, it's just interesting that you wouldn't think that there would be that connection there, but there definitely is.
yeah, yeah. We're energetic beings, but also just bags of bacteria.
Yep.
That's it, walking around. And it's fascinating. So, anything like, thank you. This was incredible. Anything that we forgot to talk about around parasites that is important for people to know?
Yes, I feel like one of the big things that we didn't get into yet is, and it's a very common question I get, is what about parasite cleansing during pregnancy or nursing?
Oh, yeah, never.
Yeah. So when somebody's I feel like, obviously with a lot of work you do, Jane, I feel like the prep work for pregnancy, getting the bodies as healthy as possible before pregnancy, I feel like that's where a lot of the work should be focused on, is
Yep.
taking that time to do the preparation and prepare the body for the task of raising a child.
Growing a baby from scratch? Yeah, it's insane. Yeah.
Yep.
It's an insane task.
Yep.
And it's hard to do it if you already have things leaching your nutrients. I think like that's the message is, hey, it's a lot of energy, like an insane amount. Your mitochondria, the healthier it is, the easier it is that's going to be. But also just like the nutrients and your methylation and detox pathways is all going to be really strained. So if you have a parasite that's leaching at your vitality on a regular basis, it's taking away from what it is that you can give to your baby. It's taking away from you. And so, again, this is why I emphasize the pre work because you'll get into it, but it's like you can't take 20 pills of Parafor twice a day when you're pregnant, or breastfeeding.
Yeah. So during pregnancy, that is not the time to be pushing detoxification or parasite cleansing. Obviously, there's some gray area there if somebody's having a bunch of symptoms. Again, there's.
Yeah, I've done some really low dose stuff. And I mean, I don't take patients on, not yet, anyways, for once they're pregnant. I take my patients that I've taken through their fertility journey, I'll take them through pregnancy and postpartum because I know them really well. And if we've treated a lot of parasites and they start to have a little bit of flare, it's like really low doses of things. It's para one cap a day versus the standard dose is 2 caps twice a day. And we'll do that for a week during the full moon, as opposed to, you know, the big pushes that we've talked about. So there is for sure some gray area, but you're doing very, very minimal if you are. And I only feel comfortable as a practitioner when I know the patient really well. Like I've seen their lab work when they're not pregnant, during the first trimester, like how I understand them and what they've done in their cleanup environment. Otherwise, it's like, no, I can't take that responsibility.
Yep. Yep.
It's too great.
Yeah, and then when it comes to nursing, there's a little bit more of wiggle room there. But again, I always like to wait until baby is at least 3 months old before start doing some more work with mom. And again, the only reason that we'd be doing work while mom is nursing is because she's dealing with some issues, or maybe a baby is too. But otherwise, if mom's doing good, we won't be doing any pushing of parasites or detoxing until she's ideally done with nursing. And there is, again, some benefits of, if the baby is having issues, and obviously trying to get a baby to swallow capsules or take supplements, obviously it's not going to happen. Yep. So we can utilize mom to transfer some of those nutrients, herbs to the baby through breast milk. So that can be a strategy or an approach to working with mom and baby if baby's again having some issues while nursing. So again, there's some workaround. But again, the main takeaway with that is you want to do the work before pregnancy or after pregnancy nursing to really do a deep dive into all the things we were talking about. Because again, we want to just take the proper precaution so that we're growing as healthy baby as we can.
Yeah, well, when I first started working with you, right, with my husband, it's like I was still breastfeeding, but I was probably around like the 16th month mark. So we started doing some drainage, but we didn't really turn on really big kind of parasite cleansing until I was completely done. And just to be like so transparent that my listeners know, it's like I had parasites with my first. I know that now. I didn't know that then. So, ignorance is bliss at some point. But I've also taken like an insane amount of nutrients when I was pregnant, which I think helped to offset some of the nutrient depletion, but I for sure like passed it on, meaning I'm on my daughter all the time, like watching for symptoms that she has around parasites and full moon. And she's already done parasite cleansing with us around the full moon. And she'll get like, she had nightmares this full moon. And it was like, can you give me the medication that helps with and it's para 3 and para 4 that we're doing. And she just takes para 3 straight up, which is very impressive for a 6-year-old. She doesn't need a lot of drops. She takes, like 5 or 6 drops and she's good, but it helps her with the nightmares, and it helps her with her digestion. So do I wish that I knew this information before I got pregnant? 100%. If you're listening to this and you didn't have this information, you have a kid and you're like, oh my God, I think it's like, yeah, it's okay. The best time to plant a tree was 10 years ago. The next best time is today. It's like, I didn't know this information either. I didn't know this either. So you can absolutely, it definitely becomes trickier with kids, but it's not like you're doomed for the rest of your life.
Yes, I agree.
Yep. Thank you. That was a really good point. Tell people where they can find you if they want to work with you. How do they get a hold of you?
Yeah, so I work through Total Body Wellness Clinic, so totalbodywellnessclinic.com.
With Dr. Randy?
That's Dr. Randy. I know he's been on here on podcast before. So Dr. Randy, myself, and Carol Egan work at Total Body Wellness. So that's where I'm at. I also work for Cellcore as a lead educational researcher. So help with educating practitioners and customers on how to utilize the supplements. So it's kind of a fun role where each kind of helps the other side of things, and having the knowledge of the supplements, working with patients, but also working with patients and the supplements helps to educate the practitioners and customers on understanding the products and how they work and the little intricacies of the products. And so, yeah.
Yep. That's awesome. Like I said, I worked with you for 18 months. Couldn't recommend it enough. If you want to dive deep into parasite cleansing, I definitely think you're the guy. Or any chronic illness, right? In general, even with Lyme, if you've been struggling for a long time, I highly, highly recommend that you reach out to Dr. Nick. Like he said, find him at Total Body Wellness Clinic and get those parasites out, guys. You can do it.
Yes, you can do it.
You'll be a better person for it. I can almost guarantee it.
Yeah. Yeah. It's definitely one of those things I feel like everybody can definitely benefit from.
In our day and age, yeah, I think like I listen and I'll listen to like Joe Rogan and he has the sniffles and it's like, oh, it's allergies. I'm like, it's parasites. It's not allergies, it's parasites. So, anyways, we'll keep talking and spreading the news and the information. I think the more people experience it, the change, it's like it's huge, it's profound. I mean, Dr. Todd started Cellcore because of his experience with parasites. So, and look at where it is now. Yeah, look at where it is now. So, thanks so much, Dr. Nick, for being here.
Yeah, my pleasure. Thanks for having me on.